So now we'll move to Shantanu with his unbelievable domain knowledge and expertise. Shantanu, the floor is all yours.
Thank you, Shamnada. It's always a pleasure to be part of the panel when you are moderating. And also, thank you, friends. A lot of common face, Subrajati Suparnams and Abhishek, of course. It's nice to be always, the work takes me to different parts of the country and the world, but always nice to be back. I'll be brief because I think we are grossly over time. So I think what I can tell that I mean, while I was working, during the COVID times, I was working with an organization which is mainly in the online healthcare domain, and I can tell you what notices the changes what we have seen. I think it is very well known that during the COVID period, it was not advisable. Neither the doctors nor the patients wanted the patients to flock in the OPD. Yeah. But yet, the hospital and the doctors have a responsibility to continue give them treatment. Particularly, think about people who have chronic diseases like diabetes or kidney disease, or in such situation, what we saw that there was a tremendous increase, at least for the time being, increase in the digital or video consultation. You know. And we also saw an increase in obtaining of service like outside hospital, like for example, diagnostic test in home wherever possible, medicine delivery at home, ICU at home, and many other services. And I believe that this will be continue to the trend during the COVID period. That I mean, that's obviously understood. But what will happen? People often ask me, what will happen post COVID? I think that's the question. Will it be exactly the same what was before COVID? I don't think so. Will it be exactly the same what was happening during COVID? So if I have to imagine a world in, let's say, a year from now, or 18 months from now, I believe the world will be somewhere in the middle. What we'll be seeing, what COVID has done to some extent, that what the demonetization did in India for financial digital payments industry. So we see more and more people will be taking digital consultation, training services at home. But mind you, it doesn't mean that 100% is going to happen in like digitally. First of all, clinically, it's not possible. There will be, I think, as a ex-clinician, I don't practice anymore. I still believe 70 to 80% patient is clinically seen first consultation. Around 70%. And may not be physically seen, but I still. Whereas the situation changes when it comes to follow-up, particularly the chronic diseases like diabetes or kidney disease. A lot of time it is just a matter of actually checking whether there was some blood test that is abnormal and asking few questions, etc. So that is to be done digitally. The second thing, as I said, that it is not a very safe place to be in a hospital or a clinic. People, once they've done a consultation, they probably want to come home immediately. And the post-consultation services, such as like people in hospital, what they will do, they move around in the hospital, go to the lab, come to the pharmacy. I think more and more people will try to quickly come out of the hospital and obtain these services more at home in the communities. But then there is, I mean, to summarize, I mean, what I want to tell that how does the hospital and the clinics needs to rise to the occasion? Because I have seen it from the outside, what can happen is that, look, we have seen to some extent in education industry, we find that the digitally providing education is becoming a norm. But then there are a lot of people who doesn't have access. So let's think about a typical patient, which is my dad. He's an 81-year-old gentleman, doesn't see well. He can't use an app, right? He's not very comfortable doing everything online as I am. So, mind you, most of the hospital, there was a study done by Gangaram Hospital, that how does a patient access a hospital in India is mostly, and we found that around 75% people actually calls the hospital, you know. So the point I'm trying to make, the futures of the hospital and clinics needs to think of a hybrid world. There will be patients like me who will be comfortable, who is not interested to come and wait in the queue, but probably will like to book an appointment with a doctor online. There will be somebody who is coming from village. He's not at all comfortable to anything. He'll just come in the morning and stand there in the queue. And there are people like my dad who would like to call up the hospital and take an appointment. So more and more, what we need to do, and then post consultation, there will be people who will be more quickly, as I said, will be like to go out, uh, go home and take the services, and there will be people who will be there. There will be people who will be need to be seen physically first time, followed by maybe virtually next time. So more and more, I think the hospitals and clinics needs to understand that how this change scenario will work and needs to have an information system. The problem what I see today, this is becoming a binary. Either you go digital or you go physical. It's not like that. There are apps, etc. They will try. I used to work for one of those app companies. They 100% on the app, but that's also not physical possible. And then there are hospitals who are says, look, people will come and just book an appointment. That's also not possible. I think more and more there is a time we should start looking at a what you call is a hybrid system where patients might actually approach you physically by analog phone, by mobile phone, by app, as well as take the service that way. And we should have information system which can actually take everything together. Like if I get a call, I used to run hospitals, a fairly large hospital. One of the biggest thing, I did not know how many patients called my hospital switchboard and what happened to them. So we should have information system which take care of the people of all segments and actually, like for example, a patient might have seen you physically and you have recorded this medical record, but next time when you see you digitally, same medical record is available. And while I was working with this digital online, I came across this company which I am representing today. Is called hOS. This is exactly what it does. It basically create a digital information system, which is the need of the hour. Obviously, we don't have time for today to show you that, but this is what I would like all the clinicians as well as administrators to think. The future of the world is hybrid, or some people is calling it digital, and we need to have systems which will be both physical and digital. The second point I want to make, I have been working on the digital healthcare companies, and most of them is driven by people who are technology background. Well, let me tell you, I mean, you will think that there will be some this that practice of the world and etc. will take over. I don't think so, because the trust is one of the key thing in healthcare, and which is where the hospitals and clinicians have. So these companies like Practos and 1mg of the world create knows how to get a very young millennial, very self-conscious individual, but they do not know how to get a typical patient, like as I say, a old man or a very young person. So the consumer connect will still going to be with the hospitals, still going with the clinicians, still going with the physical facility, but the one which will embrace this technology and probably will partner with such companies will probably win the race rather than being stuck in the old age. So that's where I would close.